Good day everyone, I'm VACUNAWA REANNE M, and we will discuss about awareness on how to prevent or eliminate sexually transmitted disease or STD. What is STD? Sexual transmitted disease or STD, also known as sexually transmitted infection (STI), are very common. Millions of new infections occur every year in the United States. STDs pass from one person to another through vaginal, oral, and anal sex. How many people get STD every year? More than 1 million sexually transmitted infections are acquired every day worldwide, the majority of which are asymptomatic. Each year, there are an estimated 374 million new infections with 1 of 4 curable STIs. In February 2022, there were 1,054 confirmed HIV positive individuals reported to the HIV, AIDS, and ART Registry of the Philippines or HARP, and were accounted to the total 96,266 reported cases since January 1984. Moreover, 28% or 297 of individuals reported in February had advanced HIV infection at the time of testing. You protect yourself. Abstinence. The most reliable way to avoid infection is to not have sex, anal, vaginal, or oral. Reduce number of sex partners. Reducing your number of sex partners can decrease your risk for STD. It is still important that you and your partner get tested and that you shared your test result with one another. Mutual monogamy. Mutual monogamy means that you agree to be sexually active with one person who has agreed to be sexually active only with you. Being in a long-term mutually monogamous relationship with an uninfected partner is one of the most reliable way to avoid STDs. But you must both be certain you are not infected with STDs. It is important to have an open and honest conversation with your partner. Use condoms. Correct and consistent use of the male latex condoms is highly effective in reducing STD transmission. Use a condom every time you have anal, vaginal, or oral sex. Common diseases caused by STDs. Chlamydia is a common STD that can cause infection among both men and women. It can cause permanent damage to a woman's reproductive system. This can make it difficult or impossible to get pregnant later. Chlamydia can also cause a potentially fatal ectopic pregnancy or pregnancy that occurs outside the womb. Gonorrhea is a sexual transmitted disease caused by infection of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the utera in women and men. Syphilis is a sexually transmitted infection or STI that can cause serious health problems without treatment. Infection develops in a stage primary, secondary, latent, and tertiary. Each stage can have different signs and symptoms. What are the treatment options? Test. Laboratory test can identify the cause and detect co-infections you might also have. Blood test. Blood test can confirm the diagnosis of HIV or later stage of syphilis. Urine samples. Some STIs can be confirmed with the urine samples. Fluid samples. If you have open genital sores, your doctor might test fluid and samples from the source to diagnose the type of infections. Antibiotics. Often a single dose can cure many sexually transmitted bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. Typically, you'll be treated for gonorrhea and chlamydia at the same time because the two infections often appear together. Antiviral drugs. If you have herpes or HIV, you'll be prescribed an antiviral drug. You have fever, herpes, recurrence if you take daily suppressive therapy with a prescription antiviral drug. However, it is still possible to give your partner herpes.